of local health officers as it relates to Montana Code Annotated 52118.
Deputy County Attorney David Randall here. I've been working with Hillary on this order and in constant discussion with her throughout this entire process. And thank you for bringing up the Montana Code. Oftentimes it's forgotten, but particularly with regard to section 50-2-118, it does basically state that the local health officer shall take steps to limit contact between people and initiate an order such as this, which has the effect of closure of buildings or facilities where people congregate. And this also includes canceling events. So certainly our local health officer has the authority and the ability to act independently of what the board decides today. But it's certainly very clear in the code, and I'd certainly stand by her order, and I'm open to any questions that you might have to.
Thank you.
I'd like to say something. Public health has been through a lot of public health emergencies. It's been smallpox, anthrax, H1N1, norovirus, and oftentimes nothing is clear cut and it changes from day to day. The best guidance we can do, the best thing we can do is rely on the guidance that we get from the CDC. It's not always perfect, it changes, but you know, we have to depend on the people at a higher level that are making those decisions and hope that they're the best. Sometimes they are, sometimes they aren't, but you know, everything is so uncertain, you have to rely on the experts and the information that they have. It changes sometimes, but these are really hard decisions that we're making, and it affects a lot of people. So I'm happy that this board takes everything so seriously, and because we are affecting people's lives, and we've got to be comfortable in the fact that we're making these decisions for the greater population, protecting their health. And so now I'm going to,
If I could.
is it a, go ahead.
No, I just want to reiterate some of what was said here. I am very concerned about our community and our economy. And as commissioner, of course, we have to look out over all of those individuals out there, and the stuff we do directly affects them. And that's a big concern. And there have been sleepless nights, and it's been tough. But at the end of the day, we're here to protect our community. And no matter how we feel in other ways, we still are here to connect our community and save them and hopefully help prevent this disease from spreading. And for this, because I sit on the health board, I look to the professionals that are here today. I want to thank them very much for being here today to address this with us, and Hillary for all your work, and everyone else in the room that's done a lot of work on this, because everybody's working hard, I can tell you that. And I think I look to the professionals for guidance, and I think today this is very important that we do this order and see where we go. I mean, it's just a short order, and I think we'll probably be looking at it again, and who knows, we may have to extend it. We all have to be ready for that. So, thank you.
I do want to say again, I said it one time, but as far as people aren't able to get in to see their doctors, that's a bit of a health problem. I mean, unless they fit the criteria, they can't get in. There was a child, probably dozens of children, a child that had a fever, had respiratory symptoms, but was an otherwise healthy kid, was actually turned away, the clinic wouldn't see them. You know, maybe you could comment on that.
I can't speak to that. I don't
But that's a major health hazard. People are, they canceled non-essential visits, including physicals and people outside.
Well, maybe the
criteria.
professionals can speak to that. Thank you.
Our respiratory clinics are seeing anybody who wants to be seen. We're trying to give advice ahead of time, both through our centralized telephone line and when people call our clinics, and our triage folks that are out in front of our clinics, about what the current testing criteria are and what the likelihood is of being tested if you're an otherwise well person who has no fever, just has a little bit of cough. In that situation, you're unlikely to get tested for COVID. That's useful information for people up front. but if they wanna come and be seen, they can be seen. With regard to trying to eliminate non-acute or non-necessary right now appointments for other things in our other clinics, we're asking providers, physicians and APCs to scrub their lists and say, hey, what do you think? Does this appointment need to be happen? But then to contact the person and say, hey, was there something else that you were planning on being seen for today, Mrs. Jones? And do you still want to come in? We're trying to limit exposure, but still attend to the other things that people still have as medical problems that need to be cared for.
But my understanding is like if a kid has a tummy ache or something like that, I mean, they're not gonna be seen by their primary care doctor, is that correct? Or
No, that's not true. Again, we're trying to keep most of the primary care clinics, including pediatric clinics, free of patients that have respiratory complaints, but continue to see those
Okay.
patients with other things.
Okay, good.
Yeah.
That's
So if
great.
you have an annual physical or something like that, that can be pushed out, or if it's a routine blood pressure check or things like those, but if there's a,
But your OBs and your,
Oh, yeah,
people,
yeah.
if people are coming in for babies, we still have emergencies. We're not
Okay,
experts.
sorry, you can't have your baby right now.
So,
and
normal,
and we're
normal.
maintaining surgeries for emergent or urgent surgery,
You
it's
bet.
just for these elective.
But
So-
radiologic tests are not being done, I mean, my office has been trying to order them, so I know there's a lot of shutdown. I mean, unless it's an emergency, radiologic tests are not being done, and that's.
Right. We're using the same criteria for that. If it's necessary for care now, absolutely we'll do it. It's just a COVID-19 patient that lies in an MRI scanner or a CT scanner requires what's called a terminal clean of that room, which can take several hours. And so we don't want to expose other patients to COVID-19 if we don't need to. And again, if it's a follow-up X-ray or CT scan for a problem that's stable, we'll delay it. If it's something that needs evaluation now for acute symptoms, no question, we'll do it.
Okay, I'd like to call for the vote now, and then do a roll call vote. Can you restate that?
I'm gonna go ahead and restate
The motion.
the motion. So the motion that we're gonna vote on is the motion to support the health officer's order and authorize the Board of Health Chair to sign. And that order has been presented to us very thoroughly today.
Okay, so, we'll do a roll call vote.
Bukichak,
Nate?
Berg,
Yes.
Holmquist,
Yes.
Larson,
Yes.
Nicosia,
Yes.
Noble,
Yes.
St. James Robinson,
Yes.
Skis,
Yes.
Waterman.
Yes.
Okay, the motion will be adopted then?
So we will, I will actually have Tamale sign it right now, and we will be posting it immediately on our website, and we have a press release ready to go out and other information to these businesses.
Any bar or member comment? Thank you guys.
Nope, I have none. Thanks, everybody. Yeah.
No, I don't. Thank you.
I'm on other legislators, things like that, you know, like that.
Oh, it's behind me. I'm sorry.
Things are in a different order
I work
today.
on water.
Put all around, that's still something that's to happen in our and she said that's. We're gonna try to get a minute like
It's not just. Anyway, thank you for being here.
I don't think so, especially because.
Right, and that part I kind of
Good,
get,
I agree,
you know, that kind of makes sense,
Yeah.
it's just informational.
Okay.
Yep.
So many people.
Yes, and that was just the one thing, because I never knew anything about the board.
I know, and it's yeah, I think one-on-one's fine, for sure.
Okay, I mean, if I should give you a copy of that. Are you a press person? Can you give him a copy of that? I'd rather have a press. Yeah, you're welcome to quote me on anything.
Well, yeah, okay, cool, I mean, so.
No, I don't. That is fine. But seriously.
I mean, you are a public official now, so.
But you can take anything on your, I'll even sign it.
I mean, they just want more, I mean, like, I'm recording it, so I can.
I'm funny, I'll sign it, you can use it, you can use it. I'm a real transparent person, that's the reason. It's like I realize my